Hello students, welcome to RG Studio. My name is Rahul. I am a teacher. इस वीडियो में मैं आपको इम्पोर्टेंट मल्टीपल चॉइस क्वेश्चंस की जानकारी देने जा रहा हूं जो कि MPH मास्टर ऑफ पब्लिक हेल्थ एंट्रेंस एग्जाम के लिए बहुत ही यूजफुल हैं, जो कि विभिन्न यूनिवर्सिटीज और इंस्टीट्यूट्स के लिए होते हैं, जैसे कि एम्स, IIPH, TISS मुंबई, जिपमेर पौंडुचेरी, निमहैंस बेंगलोर, JNU हैदराबाद यूनिवर्सिटी, लखनऊ यूनिवर्सिटी, पुणे यूनिवर्सिटी और अन्य सभी यूनिवर्सिटीज़ और इंस्टीट्यूट्स जिनके लिए MPH मास्टर ऑफ पब्लिक हेल्थ एंट्रेंस एग्जाम होता है, उन सभी के लिए वीडियो बहुत अधिक यूजफुल है। और जो कैंडिडेट्स विभिन्न यूनिवर्सिटीज़ और इंस्टीट्यूट्स के MPH और अदर कॉम्पिटिटिव एग्जाम्स की तैयारी कर रहे हैं और इसके लिए ऑनलाइन कोचिंग ज्वाइन करना चाहते हैं, इंपॉर्टेंट क्वेश्चन के PDF नोट्स लेना चाहते हैं, वो 9411513974 पे व्हाट्सअप कर सकते हैं। और कॉम्पिटिटिव एग्जाम्स की तैयारी के लिए एक व्हाट्सअप ग्रुप बना रखा है जिसका लिंक आपको डिस्क्रिप्शन बॉक्स में मिल जाएगा। चैनल को सब्सक्राइब अवश्य कर लें ताकि इंपॉर्टेंट क्वेश्चन के वीडियोज मिलते रहें और विभिन्न जॉब्स और एडमिशंस के लिए जो नए अपडेट्स आते हैं उसकी जानकारी मिलती रहे। वीडियो को लाइक, शेयर और कमेंट जरूर कीजिएगा। क्वेश्चन नंबर फर्स्ट है, विच ऑफ द फॉलोइंग स्टडी डिटरमाइन प्रिवेलेंस ऑफ डिसीजेस? ऑप्शन ए लॉन्गिट्यूडनल स्टडी, बी केस कंट्रोल स्टडी, सी कोहर्ट स्टडी, डी क्रॉस सेक्शनल स्टडी। करेक्ट आंसर है ऑप्शन डी, क्रॉस सेक्शनल स्टडी। क्रॉस सेक्शनल स्टडी determine prevalence of diseases. Its explanation is cross sectional study prevalence study aim to determine the prevalence of exposure and disease. Study method, the prevalence of disease and other variables, example criteria, risk factors are measured simultaneously at a particular point in time, that is a snapshot of the population. Question number second is, NACO is an organization which deals with which of the following health concerns? Option A HIV/AIDS, B Kala-Azar, C pneumonia, D typhoid. Correct answer is option A HIV/AIDS. NACO is an organization which deals with HIV/AIDS health concerns. Explanation is, the National AIDS Control Organization NACO, full form of NACO is the National AIDS Control Organization, established in 1992. NACO was established in 1992, is a division of India's Ministry of Health and Family Welfare that provides leadership to HIV/AIDS control program in India through 35 HIV/AIDS prevention and control societies, and is the nodal organization for formulation of policy and implementation of programs for prevention and control of HIV/AIDS in India. Next question 3, nodal agency for annual health survey AHS in India is? Option A International Institute for Population Sciences IIPS, B Office of the Registrar General and Census Commission of India, C Ministry of Health and Family Welfare, D Indian Council of Medical Research. Correct answer is option B, Office of the Registrar General and Census Commission of India. Explanation is, India's annual health survey AHS is the first survey initiative to provide district level fertility and mortality statistics by annual panel in 9 of high focus states. These includes all 8 of the Empowered Action Group EAG states and Assam. Question number 4, which of the following deaths are included in computation of neonatal mortality rate? Option A fetal deaths after 28 weeks, B deaths in the first week after birth, C deaths in the first month after birth, D deaths in the 1 to 11 months after birth. Correct answer is option C, deaths in the first month after birth. Here question is, which of the following deaths are included in computation of neonatal mortality rate? In neonatal mortality rate, deaths in the first month after birth are computation. Its explanation is, the first 28 days of life, the neonatal period. Neonatal period means the first 28 days of life is the most vulnerable time for a child's survival. Children face the highest risk of dying in their first month of life at an average global rate of 17 deaths per 1000 live births in 2019, down by 52% from 38 deaths per 1000 in 1990. Next question, fifth. Which of the following is not an institutional mechanism of National Rural Health Mission (NRHM)? A. Village Health and Sanitation Committee. B. Rogi Kalyan Samiti. C. State Health Mission. D. Mahila Mandal. Correct answer option D. Mahila Mandal. Question here is, which of the following is not an institutional mechanism of National Rural Health Mission (NRHM)? Correct answer is Mahila Mandal. Mahila Mandal is not an institutional mechanism of National Rural Health Mission (NRHM). And Village Health and Sanitation Committee, Rogi Kalyan Samiti, State Health Mission are the institutional mechanism of National Rural Health Mission (NRHM). Its explanation is, National Rural Health Mission institutional mechanism. Village Health and Sanitation Committee at village level consisting of Panchayat representatives, ANM, MPW, Anganwadi worker, teacher, ASA, community health volunteers, district health mission under the leadership of Jila Parishad with district health head as convener and all relevant departments, NGOs, private professionals, etc. represented on it. Next question, question number 6. Throughout mankind existence, population grow at a rate of dash per year. Option A 10%, B 0.002%, C 2%, D 0.5%. Correct answer option B 0.002%. Throughout mankind existence, population grow at a rate of 0.002% per year. Explanation is, the human population grow at the slow rate of less than 0.002% a year for the first several million years of our existence. Since then, the average annual rate of human population has increased to an all-time high of 2.06% in 1970. As the base number of people undergoing growth has increased, it has taken less and less. Next question 7. Which of the following services are not provided by the Anganwadi centers? Option A, immunization and health checkups. B, treatment of minor illness and referral. C, growth monitoring and supplementary feeding. D, water and sanitation. Correct answer is water and sanitation. Question here is, which of the following services are not provided by the Anganwadi centers? Correct answer is water and sanitation. Water and sanitation services are not provided by the Anganwadi centers. Immunization and health checkups, treatment of minor illness and referral, growth monitoring and supplementary feeding, these services are provided by Anganwadi centers. Explanation is, a typical Anganwadi center provides basic health care in a village. It is a part of the Indian public health care system. Basic health care activities include contraceptive counseling and supply, nutrition, education and supplementation, as well as preschool activities. Next question, question number 8. The dash is the ratio of non-working population under 15-year-old and over 64-year-old to the working age population. Option A, labor force participation rate. B, per capita population ratio. C, population transition. D, dependency ratio. Correct answer option D, dependency ratio. The dependency ratio is ratio of the non-working population under 15 years old and over 64-year-old to the working age population. Explanation is, working population, those aged between 16 and 63. When the dependency ratio is higher, it indicates that the working population faces a greater burden supporting the dependent population. Thus, the focus behind the metric is separating the working class from the non-working class. Next question 9. The sample registration system in India became operational in which among the following periods? Option A 1963 to 64, B 1969 to 70, C 1973 to 74, D 1983 to 84. Correct answer option B 1969 to 70. The sample registration system in India became operational in 1969 to 70. Explanation is the sample registration system SRS in India is based on a dual record system. The field investigation under sample registration system consists of continuous enumeration of births and deaths in a sample of villages, urban blocks by a resident part-time immunator with an independent 6-monthly retrospective survey by a full-time supervisor. Next question 10. For the estimation of crude birth rate, the denominator is option A, total population of the respective geographical area, B, total child population age 0 to 4, C, mid-year population of the respective calendar year, D, female population in reproductive age group in the respective calendar year. Correct answer option C, mid-year population of the respective calendar year. Question is for the estimation of crude birth rate, the denominator is correct answer mid-year population of the respective calendar year. Explanation is the crude birth rate CBR for a given population is defined as the ratio of the number of live births in that population to the total size of the population scaled to a denominator of 1000. It is an example of a crude rate because we use the total population in the denominator. Next question 11. Simon's model is consistent with A, population self-sufficiency and constant economic growth, B, low fertility and mortality, C, a laissez-faire population policy, D, economies of scale. Correct answer option A, laissez-faire population policy. Simon's model is consistent with correct answer laissez-faire population policy. Explanation is Herbert Simon made key contribution to enhance our understanding of the decision-making process. In fact, he pioneered the field of decision support systems. According to Simon 1960 and his later work with Nivol 1972, decision-making is a process with distinct stages. Next question 12. Which of the following is not included for the calculation of Human Development Index? A, longevity, B, education, C, income, D, housing. Correct answer option D, housing. Housing is not included for the calculation of Human Development Index, and longevity, education and income are included for the calculation of Human Development Index. Explanation is the combined statistics of a human life expectancy, income and education is the Human Development Index HDI. This is an online calculator to find the HDI as one of the updation done in 2011 with the life expectancy, gross national income, mean and expected year of schooling, Human Development Index calculator, life expectancy at birth. Next question 13. NPX column of life table refers to A, survival function, B, probability of that, C, number of persons living between ages A and A+1, C, D, expectation of life at birth. Correct answer option A, survival function. Explanation is the column of the life table include column 1 age interval x to x plus n, age interval between exact ages of each row of the life table, column 2 and qx the proportion of the population in each age interval that are alive at the beginning of the interval and dead before reaching the end of the interval. The proportion is computed from the observed mortality rates of an actual population and is used to derive the remaining columns of the life table. Next question 14. As per the norms for the health facilities in India, what population size should be served by a primary health center PSC in hilly and tribal areas? A, 20,000, B, 50,000, C, 1 lakh, D, 10,000. Correct answer 20,000. As per the norms for the health facilities in India, 20,000 population size should be served by a primary health center PSC in hilly and tribal areas. Explanation is hilly and tribal areas, the primary health center PSC staffed by medical officer and other paramedical staff serves every 30,000 population in the plains and 20,000 persons in hilly, tribal and backward areas. Each PSC is to supervise 6 sub-centers. Next question 15. For providing reliable estimates of the following, which is not an objective of the sample registration system: A. Birth rate, B. Death rates, C. Infant mortality rates, D. Migration rates. Correct answer option D, migration rates. For providing reliable estimates of the following, which is not the objective of sample registration system, correct answer is migration rates. Explanation is to give more impetus covering both rural and urban areas and wider representation of sample villages and urban blocks for causes of death. The survey of causes of deaths rural has been merged with sample registration system from 1st January 1999. The primary objective of the survey is to build up statistics on most probable causes of death for rural and urban areas using lay diagnosis reporting, post-death verbal autopsy method through post-death inquiry based on symptoms conditions. In this video, information regarding the important questions for MPH entrance exam has been given, which are very useful for various MPH entrance exams like Aiims, IIPH, TISS Mumbai, Jipmer Pondicherry, Nimhans Bangalore, JNU, हैदराबाद यूनिवर्सिटी, पुणे यूनिवर्सिटी और अन्य सभी यूनिवर्सिटीज जिनके लिए एमपीएच एंट्रेंस एग्जाम होता है और अन्य एग्जाम्स के लिए वीडियो बहुत अधिक उपयोगी है। और जो कैंडिडेट्स विभिन्न कॉम्पिटिटिव एग्जाम्स की तैयारी कर रहे हैं और इसके लिए ऑनलाइन या ऑफलाइन कोचिंग ज्वाइन करना चाहते हैं, इंपॉर्टेंट क्वेश्चन के पीडीएफ नोट्स लेना चाहते हैं, वो 9411513974 पे व्हाट्सअप कर सकते हैं। और कॉम्पिटिटिव एग्जाम्स की तैयारी के लिए एक व्हाट्सएप ग्रुप बना रखा है जिसका लिंक आपको डिस्क्रिप्शन बॉक्स में मिल जाएगा। चैनल को सब्सक्राइब अवश्य कर लें ताकि इंपॉर्टेंट क्वेश्चन के वीडियोज मिलते रहें और विभिन्न जॉब्स और एडमिशंस के लिए जो नए अपडेट्स आते हैं उसकी जानकारी मिलती रहे। वीडियो को लाइक शेयर और कमेंट जरूर कीजिएगा। वीडियो देखने के लिए बहुत बहुत धन्यवाद।